Picture this. You're a few weeks into your dream retirement stay in Portugal, Mexico, or Thailand. You slip on a wet step, feel a sharp pain, and suddenly, your forever summer turns into an ambulance ride, a foreign hospital, and doctors speaking a language you barely understand. Now, imagine someone saying, "We need to fly you to another country for proper care," and the flight alone could cost more than your car. That's the moment when three little words on your policy suddenly matter: medical evacuation and repatriation. In this video, we're going to demystify what those benefits actually do, when they kick in, and how to choose the right level of protection as a retiree planning extended time abroad. You'll see why these clauses can be the difference between a stressful story and a financial catastrophe that wipes out years of savings. If you're new here, this channel is all about helping North American retirees and others design safe, affordable lives abroad with clear, no-drama guidance. If that's your goal, tap subscribe, and let's make sure your medical evacuation and repatriation coverage is truly ready for the real world. The real risk you're insuring against. Most people think evacuation coverage is about rare, dramatic helicopter rescues from mountaintops. Those do happen, but for retirees, the more common story is quieter: a stroke, a heart attack, a bad fall, or complications from a chronic condition. The real risk isn't just getting hurt abroad, it's needing care that the local hospital cannot safely provide, or recovering well enough to travel, but being too fragile to fly home on a normal ticket. That's where evacuation and repatriation come in. Evacuation is about getting you to an appropriate medical facility. That might be in the same country, a neighboring country, or sometimes back home. Repatriation is about getting you home, either for continued treatment when you're stable, or, in the worst case, returning your remains, so your family doesn't face a complex, expensive process on their own. As retirees, we're statistically more likely to need advanced cardiac care, stroke units, and specialist follow-up. So the question isn't, will this ever happen to anyone? It's, if it happens to me or my partner, do we have a plan we can actually afford? Evacuation versus repatriation, plain language definitions. Let's strip away the jargon and define the key terms you'll see on policies. Medical evacuation, or emergency medical transportation, usually means urgent transport from where you are to the nearest appropriate medical facility. Not necessarily the best in the world, and not automatically back home. The emphasis is on speed and stabilization. Medical repatriation usually means bringing you back to your home country, or to a facility closer to home, once you're stable enough to travel, but still need care. Sometimes that's on a commercial flight with a nurse escort, sometimes it's a dedicated air ambulance. You may also see repatriation of remains, which covers the cost of preparing and transporting a body home if someone dies abroad. Without coverage, this alone can cost tens of thousands of dollars once you factor in paperwork, logistics, and specialized transport. Key point: evacuation gets you to adequate care. Repatriation gets you home when appropriate. Some policies include both under one combined limit, others separate them. You want to know exactly which you have. What this really costs in the real world. Why does everyone keep warning you about evacuation costs? Because moving a patient by air, with medical staff and equipment, is extremely expensive. Depending on distance and medical needs, a domestic air ambulance flight can easily run into the tens of thousands of dollars. International transports from places like Latin America, Europe or Asia back to North America can reach six figures, especially on long routes that require a dedicated medical jet and full team on board. In some industry reports, a single international medical air evacuation is quoted anywhere between roughly the price of a small car and the price of a house. When you add in ground ambulances at both ends, medical escorts, oxygen and intensive care level monitoring, the total can climb quickly. And remember, that's just transportation. It's on top of your hospital bills, tests and follow-up care. For many Americans, Original Medicare provides little or no help outside the U.S. in most situations, and it generally doesn't pay to fly you back home. For Canadians, provincial health plans may reimburse only a fraction of overseas emergency costs, leaving you responsible for any difference between local rates and what your province would have paid at home. If you had to sign a credit card slip for a $60,000 to $150,000 medical flight during a crisis, would you be able to? For most retirees, the honest answer is no, which is exactly why evacuation and repatriation benefits exist. Where evac and repatriation coverage actually lives. So where do these benefits come from? Usually one or more of four places. Single trip or multi-trip travel medical insurance. These often include a specific evacuation and repatriation limit. For example, $100,000, $250,000 or more. Long stay or expat health insurance. These are designed for people relocating or spending months or years abroad, and evacuation is usually built in. Membership-style evacuation programs. Some companies sell annual memberships focused mainly on getting you from point A to point B if you're hospitalized, sometimes even if local care is available, but you prefer to be treated near home. Premium cred. IT cards and employer or retiree group plans. A few offer limited evacuation benefits, but the limits may be too low for serious events. What matters is not just whether evacuation is mentioned, but how much, under what conditions, and who makes the decision to move you. In most policies, the insurer's assistance team and the treating doctor decide whether evacuation or repatriation is medically necessary. If you organize your own private flight without their approval, you may be on the hook for the bill. A reminder here, if you feel overwhelmed comparing all these options, you don't have to do it alone. We've put together a simple, retiree-friendly checklist and comparison guide for medical evacuation and travel insurance. You'll find it in the links in the description and pinned comment. The fine print that really matters. When you read evacuation and repatriation clauses, look for these make-or-break details. Coverage limits. Many specialists suggest aiming for at least $100,000 in evacuation coverage, and $250,000 or more if you're cruising, visiting remote regions, or have significant health risks. Nearest appropriate facility language. Most policies promise to take you to the nearest adequate hospital, not necessarily home. That's normal, but know it going in. Who decides? Insurers almost always require that their assistance provider approve and coordinate the evacuation. If your family charters a jet without that green light, reimbursement is unlikely. Pre-existing conditions. Many plans exclude evacuations related to conditions that weren't stable before your trip, unless you meet specific criteria or buy a waiver. Adventure or high-risk activities. If you scuba dive, trek at altitude or ride motorbikes, check whether accidents from those activities are included or excluded. Repatriation of remains. Confirm whether returning remains home is fully covered and whether that coverage shares the same limit as evacuation or has its own pot. One powerful mindset shift: Treat the evacuation benefit as a logistics and coordination service, not just a pot of money. In a crisis, you want experienced people handling airspace permissions, landing rights, visas, and hospital beds, things your family can't easily manage from a hotel room. How much coverage do you really need? So what does enough look like? For most reasonably healthy retirees taking international trips to cities with solid medical care, many experts recommend at least $100,000 in emergency medical evacuation coverage, with $250,000 or more for cruises, remote destinations, or complex health profiles. Some premium plans go as high as $500,000 or even $1 million, often for a modest extra cost. Think about your own reality. Are you mostly in well-connected urban areas, or do you love islands, mountains, and rural villages? Would you be comfortable receiving advanced treatment in your destination country, or would you strongly prefer to be flown back home? Do you have heart disease, diabetes, a history of stroke, or other conditions that might make evacuation more likely? Balance those answers against your budget. Often moving from a very low evacuation limit to a higher, more realistic one costs far less than you'd expect, but makes a huge difference if you ever need it. Your personal evacuation game plan. Coverage is only half the story. The other half is having a simple written plan that you and your partner can follow under stress. Before you leave, store your policy details in 3 places. Printed copy in your day pack, digital copy on your phone, and a copy at home with a trusted family member. Highlight the 24/7 emergency assistance number and save it in your phone favorites. That's the number you or the hospital must call to activate evacuation. List key medical details, medications, allergies, diagnoses, and your primary doctors back home, and keep that list with your passport. Once you're on the ground, if something serious happens, your first step is always local emergency services. Get to the nearest hospital or clinic. As soon as it's safe, you or a companion should contact your insurer's assistance line. Give them your policy number and let them coordinate next steps. Don't sign up for big transport bills on your own if you can possibly avoid it. Whenever you can, get the insurer's written approval before major moves. Before each long stay or scouting trip, sit down with your partner and do a 5-minute what-if run-through. If one of us is hospitalized, who calls the assistance line? Who contacts family back home? Who manages documents and money? The goal isn't to dwell on fear, it's to give your future self a script to follow on a hard day. Turn knowledge into protection. Medical evacuation and repatriation aren't the most glamorous parts of planning retirement abroad, but they may be among the most important. They protect not just your health, but the savings and dignity you've spent decades building. You've learned the difference between evacuation and repatriation, why costs can explode so quickly, how your home country's coverage often falls short overseas, and what to look for in real-world policies and limits. Most of all, you've seen that with a bit of planning, you can turn a terrifying what-if into a manageable, well-rehearsed plan. If you'd like help turning this into action, check the links in the description and pinned comment. We've included a retiree-friendly evacuation and insurance checklist, plus tools for comparing plans that can cover you properly when you're living or traveling abroad. And if this episode helped you feel more confident about your future life overseas, consider subscribing to Travel Choir, hitting like, and sharing this with someone who dreams of retiring abroad but worries about medical emergencies. Next, watch our deep dive on healthcare abroad and international medical insurance so you can choose coverage that fits your budget and lifestyle, and then get back to planning the fun parts of your retirement adventure.